I'm Dr. Heather Jenny. I'm a pediatric hospitalist at the Goryeb Children's Hospital in Morristown, New Jersey, and I'm going to tell you about jaundice in newborns. So you may notice a yellowish discoloration of the skin and the whites of the eyes of your newborn in the first week of life, and this is what we call jaundice. Jaundice itself is not a disease. It's actually a sign of an increased level of bilirubin in your baby's blood. Jaundice can be caused by many different things, although the vast majority of newborns have what we call physiologic jaundice. And it's caused by an immature liver not being able to process bilirubin as quickly as we would like it to in the first few days of life. Jaundice is very common in newborns. More than half of full-term newborns will develop jaundice at some period during the first week of life. And up to 80% of premature infants can develop jaundice as well. Many full-term babies will develop jaundice on the second or third day of life, so it may not always be apparent before you leave the hospital. You may notice it at home, or your pediatrician might notice it at your first visit. So most infants won't show any symptoms when they're jaundiced other than the yellow discoloration of their skin and their eyes. Some babies will get more tired or have trouble feeding, exhibit a high-pitched cry, or seem weaker than usual, and those would be more worrisome signs to look for in a jaundiced baby. Jaundice doesn't always need to be treated. What's important is to determine the level of bilirubin in your baby's blood. If it reaches a high enough level that we're concerned, then we would treat the baby. And the way that we treat the baby, the first line of treatment would be to place the baby under phototherapy. When we place a baby under phototherapy, we undress them down to their diaper and we place a protective shield over their eyes. And then they just lay under the lights for 24 to 48 hours until the lights help them break down the bilirubin and excrete it through their urine and stool. Almost all babies have some increase in the level of bilirubin in their blood in the first few days of life, and that probably can't be prevented. But what might be preventable is how high the level gets. And one thing you can do is make sure that the baby's eating frequently, every 2 to 3 hours, or sometimes even more than that throughout the day, to encourage them to have more urine and more stool, which is how they excrete bilirubin from their bodies. A baby with jaundice can absolutely be breastfed in most cases. Your pediatrician might recommend that you express breast milk in between feeds and supplement with that, or if you feel comfortable with it, you might want to supplement with formula, and your pediatrician can give you guidance on that. If your bilirubin levels get very high and they are not treated, then there can be permanent damage associated with jaundice. The developing newborn brain is very sensitive to bilirubin, and bilirubin is toxic to that developing brain. So we're very careful to test babies for bilirubin and make sure that we are keeping the level in a safe range. So almost all babies are tested either through the skin or by a blood test before they leave the hospital to check their bilirubin levels. But that level may need to be checked again at a follow-up visit with your pediatrician. The American Academy of Pediatrics does recommend that you see your pediatrician within 48 hours of leaving the hospital, especially if your baby was born vaginally, since you'll have a very short stay in the hospital. And those levels will be followed, and if they reach a high enough level, then your baby may need to be readmitted to be treated.